Her mother had the insight to ask me to look at her leg lengths and look at her right knee, because earlier we were focusing on the leg because she gets some hip discomfort, some knee pain on the right, which she's able to self-manage with stretching her knee, stretching her hip rather. Today looked like she had a 3/16 to 1/4 inch leg length difference. And I'm going to have Rose tell you in her own words, how did you feel when we first put the heel lift in the left shoe?
The heel lift in the left shoe balanced out the weight I was putting on each foot, because for a while I was landing heavier on my right foot than my left.
Yeah, and we could hear you stepping heavier on the right leg, on the longer leg. And when you laid on your back, your right knee was flexed about 5 degrees. I was able to do a normal spring recoil test through that knee, so there wasn't a contracture. You know, there wasn't something that needed stretching or mobilization. And so then we went on and gave you the heel lift and told you to use it. And checked the hips and checked the pelvis, treated your L5. You had a little rotation at L5, and you had increased muscle tone at about L3 up to about T8 on the left. And you treated that sitting, forward bending, left side bending to the left. You did that very gently at end range, 30 reps, and that straightened out, the muscle tone equalized. So then we went and treated your occipitoatlantal joint, found an oblique restriction there. So we restored that. And then her mother, Karen, said, well, look at the leg length again and the knee. And we did. And then I saw the leg lengths as being equal and the knee was no longer flexed. So then we had you walk, and you walked without the heel lift. And how did that feel?
It felt like it did with the heel lift. It felt like I was balanced.
Okay, so now you felt balanced without the heel lift. And then we put the heel lift back in the left side, and how did that feel?
When I put the heel lift back in the left side, it felt uneven again.
Yeah. So it's a very interesting response, and it's interesting that treating the occipitoatlantal joint helped normalize tone in her body such that she no longer had a functional leg length inequality, and that she now felt comfortable walking without a heel lift, whereas prior to that, the heel lift increased her comfort. So, interesting case. Thanks for letting me film it.